This program contains actual surgical procedures. Viewer discretion is advised. The Long Island Plastic Surgical Group is the largest practice of its kind in the U.S., comprising 12 surgeons specializing in every facet of plastic surgery, as well as running the country's leading plastic surgery teaching residency. The group has been providing care to the people of the New York area and beyond since 1948, and now sees around 1,000 patients each week through trauma and burns work at nearby Nassau University Medical Center, the groundbreaking cleft lip and palate group, to more conventional cosmetic work. Over the years, the group's offices in Garden City, New York have been the scene of some amazing human stories. For the first time, our cameras have been allowed to follow the triumphs and transformations, all taking place an hour from the heart of Manhattan. Former flight attendant Rosemarie Chase is a repeat customer at the plastic surgeons.
It was less than an A. After, it was very unusual. You find you bump into doorways and stuff with them. But it made me feel good. I could actually go into a store and fit into an actual bra, whereas before bras didn't fit. So it was very exciting to have breasts. It's very empowering. It makes you feel like a woman. I've never regretted having the first operation. Actually, I was very glad that I did do it. I did it in my early 20s, and I think that was a good age. And I just regret that it didn't last longer. So I'm having it redone, and I'm looking forward to it.
I'm happy with her. Happy with her since the beginning. From A, happy to B, and now I'm happy now, and I'm going to be even happier now, even after this. This is like A, B, C, D now.
Me and my husband are going to celebrate by going to Victoria's Secrets and picking out a few nice lingerie pieces together.
Rosemary's decided to go for slightly larger new implants and a mastopexy, or breast lift.
Well, going for surgery in 3 days. You're nervous?
I'm very nervous about it coming up.
Yeah.
But I think it should go well.
You'll be fine. As long as everything goes fine, you'll be fine. Positive thoughts.
Well, I trust Dr. Davenport, and I'm sure it should go well.
But little did Rosemarie and Garrett know the problems that lay ahead. Former flight attendant Rosemarie Chase is having her operation today. Replacement breast implants and a breast lift, or mastopexy.
You pick out a nice, happy place, right? We'll send you on vacation for a couple hours. Where do you want to go?
Hawaii.
Maybe Hawaii?
Me too.
We'll all go. You take us with us, right, Rosie?
Yeah.
Awesome. You keep breathing nice big breaths, okay? Fill your lungs up.
She already has implants in. We have an idea of how large she wants to be, and we're just going to go up probably about 50 cc's or so, maybe 100 cc's. Just because she wants a upper pole fullness, so we can probably deliver that with a larger expander as well as the mastopexy. But we have all the sizes here that we need. We have different sizes. So we actually put a temporary implant in, sit her up on the table, put in a temporary implant where we fill up and we get a sense of what size we want to use. And then we open up the permanent implant and use that. This way, we don't have to keep opening up different size implants, putting them in, see how they look. We'll take the 300 sizer. And I'll just open it up, and I'll take it. Okay, perfect.
You know, the anesthesia always gets shaft.
The anesthetist and Nurse Patty always check up on patients as they wake from the operation. When Rosemarie comes around fully, she's keen to check out whether she got what she wanted.
Everything looks really well. I was trying to check out the cleavage and stuff, see how much cleavage they gave me and stuff. looking nice. It's hard to tell from the looking down position, but it looks good.
A week after the operation, Rosemary's in for her routine checkup.
But I love the way everything looks. How do you feel? What do you think?
I'm happy. I'm so happy. Absolutely. They're great. Big difference.
One of the reasons I love doing that procedure is that as time goes on, it even looks more natural and more feminine.
I had a smile from ear to ear, and I'm full. It's perky. They're up there. They're looking good. I'm happy.
I didn't invent the procedure, but it's really a home run.
I see the doctor again in a week, and I think a week after that, then he said too.
But Rosemary was to see Dr. Davenport much sooner than that, and in all the wrong circumstances. Mom of two Rosemary was happy with her breast lift and augmentation. But things took a terrible turn for the worse.
Well, we got some really sad news.
Just 4 days after this interview, Rosemary was in a serious car accident. A tree fell onto her moving car coming onto the Long Island Expressway. Fire crews who had to cut her out of the smashed-up vehicle were said to be surprised that she was still alive.
I was taken to North Shore Hospital, and I broke my pelvis, and I had a very bad foot injury, and the airbag opened up the implants, and Dr. Davenport came to the hospital.
Yeah, and this is the first time I ever experienced something like this, where a patient has had an accident so early after the surgery. We just checked that the implants were intact, we checked that they were in the correct position, and all the suture lines were opened again. So it was quite a shock to the emergency room doctors when they saw this, and they called me emergently, and also they asked me to see her because she had some burns on her leg from the antifreeze from the accident, so I was also seeing her for the burns as well as the wounds on her leg from the accident.
Dr. Davenport was so fantastic. He came to the hospital when he called.
It's great.
Stitched me up after the implants opened up from the impact. And he came to the rehab when I needed him to come and check on my ankle. He's been so great this whole thing. We're so lucky to have a doctor who really cares.
Yes. He gave me his cell phone number, told me to call him, anything, if I need him. He said he'd be there. And he was. Came right there.
It's common for the Long Island Plastic Surgical Group's doctors to be called in on emergency cases, as Dr. Davenport explains.
The same doctor who is doing your breast augmentation is also the same doctor who, if you were in danger of losing your leg, you would call as well.
Rosemary is in and out of the hospital having intensive rehabilitation and won't be walking again for a year. But she's lucky to have been pulled out of her Jeep alive.
She has a long recovery ahead of her. She's got to go to rehab. She's going to have to learn how to walk again.
I have now a plate in my hip with screws, and I have plates and screws in my foot, and I still need a few more surgeries on my foot. Dr. Davenport came to the hospital and sewed my chest back up. So he did it twice, and thank God they're still beautiful, and I'm very happy with them.
A few weeks later, Rosemary's out of hospital and on her way home.
Well, it's been a week since I've been home now, getting around in the wheelchair, helping out as much as I can. I can use the crutches to get up and down the stairs. Every day I'm getting a little stronger and feeling better.
So Rosemary's back with her family and on the road to recovery.